It's a question many of us moms with small kids ask, or older kids. When is it the right time to take them to the dentist? Well, Dr. L'Oreal Alter from Great Expressions Dental Centers joins us with those answers and many more. Good morning.
Good morning. Thank you for having me.
We've been chatting away this morning. Yes. And you know, summertime I think is a great time to maybe get the kids in, whether they've been in or not yet already. Right. But kids are out of school. This is kind of a good time to make sure they finally go in, see that dentist. It's so important. Talk about a pediatric dentist, though. Yes. Why do kids need to be seeing a specialized dentist that knows what they're doing with pediatrics?
Yeah, well, a pediatric dentist is essentially a pediatrician in dentistry.
Yeah.
We've done an extra 2 to 3 years in specialized training in adolescents, in infants, children, and patients with special needs. So we have tailored a little bit more centralized for children. We have our facilities are more centralized for children. We have different murals on the wall. Okay. We have different toys. Even our language that we use with children is very different, especially behavior management. We want to make sure the child is comfortable. A child at 2 is different than a child at 5, yes. So we want to make sure that those differences are managed really well.
Well, and I would imagine if you get kids in early, and yes. we're going to talk about how early in just a second, if they have a good experience from the get-go, it's got to make it so much easier as they get older to want to go behave when they're there, right? Do you see that?
Absolutely. So if we see children early and they have a positive experience, we can develop that dental home, and then they'll want to come back to that dental home, and they'll establish good habits from the beginning all the way through the future, so they feel like they know how to take care of themselves. It's recommended by the American Academy of Pediatric Dentistry to actually have the child seen by age 1 or 6 months after the eruption of their first tooth.
I think parents are going to be surprised by that, because that's surprising. Early, but why is it so important? I think a lot of parents assume, well, baby teeth are going to fall out. Why do we need to make sure that they're, you know, really taken care of?
So we want to, at that time, it does seem early, but we're evaluating the mouth not just for cavities, but for future cavities. So we'll be able to look at the mouth and see just developmental problems that might be there, or different habits that are happening at home that we can screen for, and try and tailor different preventative methods. The main goal is prevention. We really want to make sure that instead of having a cavity, we can prevent those cavities. So if we see them really young, we can work with the caregiver or the parents and really talk about different ways that we can prevent cavities from happening in the future.
And prevention, I would imagine our diet is a huge part of that. And I'm guilty as a mom as well. I mean, it's so tempting to give kids fruit snacks all the time and things that are gooey and sweet, but you say as much as you can. Stay away from fruit snacks. What are some other things that we should keep in mind during the summertime? The
summertime is such an exciting time. There's different things happening. There's different parties, activities, sports activities. The main thing is the sweets. We really want to try and keep the sweets and the sugar to a low. So the fruit snacks, even though it says fruit in the name, and it's so tempting, especially as a mom, to say, hey, it's a fruit snack, and it comes in a bag. Try and limit the fruit snacks, because they're sticky and they're sweet. So try something more like grapes. If we're choosing between grapes and Gushers, go for the grapes. Okay. If we're going between grapes and carrot sticks, I would say go for the carrot sticks. Even that has less sugar. So you want to try and tailor that a little bit more for your child.
Well, and let's talk about brushing too, because even if you do at an occasion, let's be honest, we are going to give us at some point. You say just brush quickly as well. Make sure we are brushing.
We want to make sure the summertime is a time, like I said, that there's all these activities going on. So try and maintain that routine. Brush in the morning, and most importantly, try and make sure you brush at night. For children less than 2 years of age, we still want to use toothpaste with fluoride, but the amount that we want to use is just a smear, or the amount of a grain of rice. The pea-size amount is between 2 and 5 years old.
Okay, good.
When they start learning how to rinse and spit. But we do want to try and make sure that we get the plaque off the teeth and we have that good habit.
Okay. I have so many more questions. We're out of time, but that just means that you guys have to come back, because I know you're so passionate about making sure that families and their kids, that we're keeping their smiles beautiful and healthy. So thank you so much for being here this morning. Again, I learned a lot. Great reminders for parents this summer. There is their information there as far as their number to call to where you can make an appointment this summer. Get in now, and their website and Facebook page as well. So, Doctor, thank you so much for being here.
Thank you for having me.